is Neily on Nutrition. I am with Hope Warshaw. She's a diabetes educator and registered dietitian. I'm so privileged to have you sitting here with me in Philadelphia at Food and Nutrition Conference. Hope also is an author of many diabetes books, and we are talking about diabetes, pre-diabetes in particular. So let's talk statistics.
Sure. So just to frame this in for people, about 80 million people in the United States are thought to have prediabetes. And
that's prediabetes.
That's
and
prediabetes.
Not diabetes.
It's
right.
not diabetes. We know about 26 million people have diabetes, either type 1 or type 2.
Right.
And that's not pregnancy diabetes.
Yes.
I think a critical number that people know is that only about 10% of that 80 million people know they have prediabetes. So that's an important message, is that if people have a family history of type 2 diabetes, if they are overweight, if they feel like they have other risk factors for type 2, don't wait for your physician or your primary care provider to say this. That's right. I would recommend that people go to the American Diabetes Association risk test, diabetes.org, or just search on diabetes risk test. I think it takes about 30 seconds. And you can just get a gauge. It's not going to diagnose, but it's going to help you sort of think about whether you may have prediabetes. What I think is so critical, and why I think it's so critical that people know this, is that the time to take action is as early as possible. What we know from many studies around prediabetes that have been done across the globe is that the sooner you take action, losing a small amount of weight can help delay the progression of the onset of type 2 diabetes. Now, people don't have in their mind that diabetes is a progressive disease. They don't know that. It is. It is a progressive disease. And we know that at the point that people are diagnosed with type 2 diabetes, they've already lost 50 to 80% of their insulin-making capacity. Function cells, we don't totally know exactly which, but they're already far down the road. And what we know from studies is that losing 5 to 7% of body weight, that's 10 to 20 pounds from your starting weight, working hard to keep as much of that off as you can definitely delay the progression of type 2 diabetes. I hear stories every day of people losing some weight, making those critical eating habit and exercise behavior changes, and not only reversing their road with diabetes, but making changes in a myriad of other health disorders. Now, losing that amount of weight has been shown to decrease sleep apnea. You're decreasing some risk for some cancers. So it is that little bit of weight loss has incredible power.
And to define prediabetes, it's a fasting blood sugar of 100 to 125. And then also you were saying the A1C, which is a measure of average of blood sugar over
2 to 3 months.
2 to 3 months.
Right.
And that number should be?
The prediabetes number is greater than 5.7, less than 6.4. It's a percent, and it's like a videotape of the last 2 to 3 months of all the ups and downs of your blood sugar. And since 2010, that has been sort of okayed as a diagnostic measure of diabetes and prediabetes.
So, but a physician might not. I mean, we always check blood sugar, glucose, in a chemistry test, a blood test. I mean, or just the lab test that they might do. But the A1C is not always.
You can't expect that necessarily that primary care providers know about or think about measuring an A1C.
Right. Yeah.
There so often our medical people are in sort of crisis handling mode.
Yes.
And don't have a prevention mindset.
Right.
More and more do, and I'm not taking anything away. They have a lot to manage. Yeah. So I do believe that people who may be at risk need to be their own best advocate.
Excellent. So checking out diabetes.org or just a risk assessment for prediabetes, and taking action, losing. If somebody's 200 pounds, that would be like 190.
Right. It's not about going on a diet.
No.
Or finding the latest, greatest bad diet.
Yeah. You'll lose weight, but you won't. It's
simple changes.
To lose that weight and keep it off. Right. That's the most critical thing. Okay, great. And we'll talk more about some other things in another video, but. Excellent information. Great. Prediabetes is definitely on the rise, and only will continue to be. It's a wow. Yeah, it is a big wow. Yeah. Thanks so much, Hope. This is Neily on nutrition, and we'll see you in the next video.